when I first came to the UK, I wasn't yet decided on ophthalmology. I was thinking about ophthalmology and some other specialties. And the response I got from a lot of my seniors was, oh, you want to do ophthalmology? You know, you should have a plan B, you should prepare to fail at least 1 or 2 times. Most people apply 3 times to get in, 2 to 3 times. And they also felt like, because I didn't train in the UK, that I wouldn't be able to compete with the local graduates. But I did. So good morning, everyone. Can everyone hear me clearly in the back? So I just want to thank Naseer for inviting me to speak here today. Nick and I are always happy to help other IMGs who want to pursue their careers here in the UK. And thank you to the organisers for bringing everyone together. So my talk is about ophthalmology training in the UK. And I'm just going to go a little bit about myself and my experience, ophthalmology as a career, the training pathway and strategies for success, and 10 minutes for questions at the end. Is anyone here interested in a career in ophthalmology? A few. Maybe I could convince some more by the end of the session. So yeah, this is me. I graduated in the Philippines in 2013, and then I was doing sort of mid-2013 June, and then I did my plan for my GMC registration in the year after. I started in the UK Foundation program in 2014, so I am a British citizen, so it was a bit easier for me to enter into training that way. And then I started ophthalmology training directly after F2 in 2016, and I'll actually be starting my ST3 year here at King's College Hospital. So ophthalmology as a career. People think it's just eyes, and maybe it is sometimes, but a lot of the time the pathology we see is quite diverse. We can have sort of everyday mundane things like dry eyes and itchy eyes, but we can also have sight-threatening and even life-threatening conditions. We've had patients come to us with eye problems, but in fact they're having a stroke or they have infective endocarditis. So it's quite an interesting specialty. There is an experience limit, so if you have worked 18 months or more in ophthalmology, then you would not be able to apply for ST1, but you can apply for ST3. The applications open in November. That's when all round 1 applications open, and the interviews around Feb. So my application, I applied as an F2, and when I first came to the UK, I wasn't yet decided on ophthalmology. I was thinking about ophthalmology and some other specialties. And the response I got from a lot of my seniors was, oh, you want to do ophthalmology? You know, you should have a plan B, you should prepare to fail at least 1 or 2 times. Most people apply 3 times to get in, 2 to 3 times. And they also felt like, because I didn't train in the UK, that I wouldn't be able to compete with the local graduates. But I did, and I met a lot of trainees who didn't get in the first time. They got in after 2 tries, but I kind of felt that I could see where they were going wrong. Because I was from the outside, I could see it more objectively. So in terms of succeeding with your application, there are 2 major components. And can anyone here sort of tell me what they think those major components are? Any guesses? Yeah? Yeah? Good? Yeah? And? Yeah, so that's good. That is the first thing that you need. You need to be exempt from RLMT in order to be successful with ophthalmology training. And the second is to have a high application score. So the other 2 that you definitely will get RLMT exemption is standalone FY2 and WASP. So these are 2 entry-level jobs sponsored by Health Education England, and therefore you'll be eligible for round 1 for any specialty. That's it, I think. Thank you. Does anyone have any questions? Yeah.
For the WASP, do you have to start in August?
You should start starting in August, yes. So if you are trying to get exam from RLMT with WAS, there are 2 start dates, Feb and August, but you need to start in August because if your sponsorship with HED ends in Feb, then you will have that gap between Feb and August. So any other questions? Yeah?
Is there a website where we can look up the scoring criteria for other specialties as well?
So each specialty does have their own criteria on the recruitment website. So on our website, on our useful links section, we've linked to each specialty and then you can find the scoring criteria there.
Any other questions?
Yeah, thank you.